Hey guys, it's Dr. Hart, and this is Nursing with Hart, PhD, and these are some questions to follow up on the schizophrenia lecture that I posted yesterday. There are two of them. There's a part 1, and I'm going to do a part 2. I came up with about 10 good questions altogether, so I split them up into two presentations for you. Just to give you a quick background of me, I have been a psych nurse for 10 years, and then I was a nurse educator for the last 5 years before retiring. And I have started a YouTube channel, and also I'm on TikTok. I'll put the links in my bio. TikTok and also Instagram, so check those out. If you like the YouTube channel, please like, share, and subscribe to my YouTube channel, and then you'll get the latest videos. Alright, let's get started. So here's the first one. Okay, a client diagnosed with schizophrenia refuses to take their medication, and they're telling you, I have the right of autonomy, which they do. Under which circumstance would the nurse have the right to medicate the client? So in other words, under which circumstance would they possibly lose that right, and the nurse would have the legal right to medicate them? Okay, so this is also covered under the ethical and legal issues video that I posted previously, so I'll also put that in the description of this video, the links to the ethical and legal, because this is an ethical type question. Okay, here are your answer choices. 1, the client makes inappropriate sexual innuendos to a staff member. 2, the client repeatedly demands constant attention from the nurse. 3, the client physically attacks another client during group therapy. Or 4, the client refuses to bathe or attend to their personal hygiene. Alright, and I'll give you a minute to check these out and decide which one looks like the correct answer. So I've decided to, in the meantime, share this content in these videos. I care so much about my students that I miss them terribly, and I miss teaching. So I thought I would do this for the benefit of you as a nursing student, because I understand the struggle. I understand the struggle with education. I have 2 years at my local Palm Beach State College was my associate degree program. Then I did the bachelor degree program at Palm Beach State. It was a BSN, RN to BSN. That was another 2 years. On to my master's degree. That was 1 year at Capella University, master's in nursing. And then my PhD in nursing education was 3 years at Capella University. So that's my credential background. So let's go back to this test question and see what the correct answer is. Okay, and so the correct answer for this one is number 3. The client physically attacks another client during group therapy. Okay, so the ethical in the ethical lecture that I did, I talked about patient rights, and even clients who are involuntarily admitted, I'll say it again, involuntarily admitted, still have patient rights. They have the right to refuse. They have medications. They have the right to refuse vital signs. They have the right to refuse a shower. The situation where they lose their right, patient rights, is a situation where they are putting themselves or someone else, another client or someone else at the facility at harm. Okay, they're at risk of harming themselves or others. That's the situation where they would lose the right and the nurse would have the legal right to medicate that client. Okay, so that explains the correct answer. Let's look at those other answer choices. Okay, number 1, the client makes inappropriate sexual innuendos to a staff member. This is inappropriate behavior, admittedly, but it's not something that's going to take away a patient's rights. They're not harming themselves or others. Number 2, the client repeatedly demands constant attention from the nurse. This is also inappropriate behavior, demanding constant attention, but they're not putting anyone, themselves or anyone else, at risk. Okay, so for this, they would not lose their patient rights. And then number 4, the client refuses to bathe or attend to personal hygiene. Okay, so again, the client who's refusing to take a bath or shower is not at a threat of harming themselves or others. While taking care of their personal hygiene is important, and as the nurse, you should encourage your clients to do so, but again, they're not at risk of harming themselves or others. All right, let's look at the next one. Okay, client diagnosed with schizophrenia tells the nurse, the Shapatulians took my shoes out of my room last night. Which is the correct charting entry to describe this client's statement? Okay, this is material that I covered in my lecture on schizophrenia. Okay, and so you have to know the different types of positive symptoms. And this one in particular is a speech positive symptom affecting the speech of the client. And I covered all of those in my lecture, so go back and check that out. Okay, here are the answer choices. The client is speaking with clang associations. The client is expressing feelings with a neologism. 3, the client demonstrates paranoid thinking. Or 4, the client is communicating with a word salad. And I'll give you a minute to think about it. Okay, let's come back to this one. All right, so here the correct answer is number 2. The client is expressing feelings with a neologism. Excuse me. So the neologism is an invented word, invented by the client. They truly feel that this is a true word, but it's not a true word. And the neologism in this case is the Shapatulians. Okay, that's not a real word. So that is number 2. That's a neologism. Let's look at the other answer choices. Number 1, the client is speaking with clang association. Okay, so clang association are words governed by sounds, like words that rhyme in a sentence. Okay, I have a ring and it's going to cling. You have a ball and you're going into the hall. Those are some examples of words that rhyme in a sentence, and that's a clang association. Okay, often in the form of rhymes. Okay, let's look at number 3. The client demonstrates paranoid thinking. Okay, that's not paranoid thinking. Paranoid thinking is where the client is very suspicious of others. Okay, they are perceiving others that they're paranoid about something, and the client in this case is not having paranoid thinking. All right, and number 4, client is communicating with a word salad. So a word salad is words put together that are random and have no connection, like the airport took all the traffic, something like that, where the words are put together in a sentence, but put together in a way that they don't make any sense. Okay, all right, let's go on to the next one. Which statement indicates to the nurse that the client is experiencing a delusion? Okay, so when I covered delusions in my lecture, delusions are fixed false beliefs, okay, that are irrational and the person maintains they thinks they are true despite any evidence that shows they are not. Okay, delusions. Now you have to know the difference between delusions and illusions. Okay, delusions are fixed false beliefs. Illusions are misperceptions or misinterpretations of real external stimuli. So like an illusion is like the patient sees a cord in the room coming from the IV pole and they think it's a snake. Okay, that's an illusion. There is really something there, but they're misinterpreting it. Their perception is off and they're misinterpreting what it is. Okay, a delusion is something that's definitely nothing that is there. Okay. All right. So which one of these is a delusion? I'll give you a minute to think about it. Okay, and the correct answer on this one is number 1. Spies are watching everything I do. That's a delusion. Okay, there are the different types of delusions that I covered. Okay, persecutory, grandiose delusions, that you're feeling that the person is feeling they're better than everyone else. I covered all of those in my lecture. The different types of delusions. So spies are watching everything I do. Obviously, that's not true. That's a false belief. Okay, so the answer is number 1. Let's go over the other answer choices. Number 2, there's a worm on the back of the television. So this is an example of an illusion that I just talked about. An illusion, they're looking at the TV is really there, but they see something on the back of the TV, say it's the cord, and they're having an illusion that they think it's a worm instead of the cord. Okay. Number 3, bugs are crawling all over me. Okay, that is not the correct answer. This is a tactile hallucination. This is a feeling on the skin that something is actually crawling on the skin, and that's common for patients with schizophrenia to have tactile hallucinations. Okay, I talked about the different types of hallucinations. Tactile are crawling in the skin, feelings on the skin. Visual hallucinations, seeing something that's not there. Auditory hallucinations, hearing something that's not there, and especially I talked about the danger with command hallucinations if the patient has hearing someone telling them to do something. As the nurse, if your patient expresses that to you, you want to definitely dive a little deeper into that and ask them some more questions about what are those voices telling you to do, because we want to find out if the voices are telling the client to hurt themselves or others. Okay, and then number 4, answer choice. I really don't feel like going to group today. Okay, and that is not a delusion. Okay, that's a lack of motivation or avolition. That's actually a negative symptom of schizophrenia. Negative. Avolition, I talked about the negative symptoms that begin with the letter A or an, means without. The prefix A or an means without. So avolition is without motivation, and that's a negative symptom of schizophrenia. Okay, let's go on to the next one. We got one more on this one. Okay, so the nurse is educating the parents of a child diagnosed with schizophrenia on how to reply when the child experiences auditory hallucinations, which is the nurse's best reply. Okay, I already talked about this in this video, so you should get this with no trouble. All right, so take a look at this. Let's look at the answer choices. Number 1, tell him to stop talking about the voices. Number 2, ask him what the voices are saying to him. Number 3, tell him you know the voices are real to him. Number 4, encourage him not to worry about the voices. Okay, we'll give you a minute and we'll come back. Okay, we're back. All right, let's look at these answer choices. So let's look at the correct answer. Okay, the correct answer is number 2. Ask him what the voices are saying to him. So you want to do that deep dive. You want to ask some more questions. You're going to, as the nurse, right? The nurse, think of the nursing process. You need to assess first. Okay, ask if you're educating the parents of a child with schizophrenia. Let them know that if their child is expressing auditory hallucinations, educate them on telling them to ask the child what the voices are saying to them, so you can find out whether or not these voices are telling them to hurt themselves or others. Okay, let's go over these other answer choices. Number 1, tell them to stop talking about the voices. Okay, that's not going to help. That is not demonstrating empathy for the child. Okay, and that's not going to help the child to ground them to reality. It's not going to help your assessment. Okay. Number 2, ask him, oh, that's the correct answer. Number 3, tell him you know the voices are real to him. Okay, safety is always the nurse's priority, so we should first, as the nurse, assess whether the child is having command hallucinations. That's the priority, is safety. And encourage the parents to acknowledge encouraging the parents to acknowledge the voices are real to the child, but let the child know they they do not share the perception. Okay, and number 4, encourage him not to worry about the voices. Okay, hallucinations can be very frightening. Okay, and to encourage, tell the patients, tell the parents to tell their child not to worry about the voices. That's totally disregarding their feelings. And we want to concentrate on safety, okay? And we want to do a deep dive and assess what's really going on with those command hallucinations. That's very important. Okay, and I know that you are a very caring nursing student, and you're going to be an excellent nurse, and you're going to be a very caring nurse. And if you have clients, even on a med-surg floor, doesn't have to be a psych unit. If you have clients on a med-surg floor, or even a maternity floor, ICU, emergency room, it will help you to get an idea of how to best assess these clients and how to interact with them. Okay, and I hope these help you. All right, and we'll see you on the next one. Have a great day.